Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax compilation video today. We have 3 patients in this video. So this first patient's come through with reduced hearing on just on one side. We can see some very hardened up wax here at the entrance to the canal, and what we're doing at the moment is just loosening this wax away. What you'll see at the base of the canal, just below the suction tube, I'll point it out for you in a second, is actually a bit of dried blood. So they've actually broken the blood vessel here at the front end of the ear canal. Which is going to become a little bit more important a bit later on. So what we're going to do here is just loosen from the sides. Now as we loosen this drier, harder wax, what you can see is that we've got a much wetter substance just below the wax or underneath it. So you can see to the left hand side of that wax there, and these long stringy bits of wet skin coming away. So this outer drier section here has been trapping what I think is what looks like Otitis externa behind it. So we're going to need to take this away to get a good look at it. You can see there that white, sluffy, dead skin. With Otitis externa, you get this milky kind of discharge coming away from the canal walls as well, just due to the irritation. Just taking away some of this drier bits. Now, the reason that blood vessel became a little bit more important, there's a piece, this is actually dry skin at the base of the canal underneath this section here, which is firmly attached to that skin right on top of that kind of burst blood vessel. So if I go pulling that away, it's going to cause bleeding. So I'm leaving that there for the time being. And I'll get a good look at it a bit later on. You can see this wet skin material coming away here. Otitis externa is like a kind of a bacterial infection basically of the outer part of the ear canal, so irritation to the canal. You do tend to get a lot of discharge with it, and what you can see here is all this dead skin coming away. You can see it looks really aggravated in here. One of the complications you can get with Otitis externa is you can get it starting to actually degrade the skin. And it can actually start forming some kind of more granular tissue. And what we're doing here is just taking some of this wetter debris away. You can see a couple of little red marks in there, which I'll point out for you in a second. Just having another go at this little bit of dry skin, just to see how firmly attached this is, but it is solidly on top of that burst blood vessel, so I'm going to leave that well alone. You can see the wetter material here, so I'm just going to start just taking some of those bits away, so I can get a good look at the skin underneath. If it is the type of Otitis externa that degrades the skin, it can actually get into the bone as well, so it's quite nasty. Now you can see some red marks there where the skin's come away and it's exposing the kind of blood vessels underneath. I think this is possibly a kind of a necrotizing Otitis externa. So we sent this patient along to their GP to get a referral into the ear, nose and throat department. This needs to be treated with antibiotics and as a matter of kind of urgency, really. This is our second patient here. You can see we've got some skin tissue here just covering the entrance to the canal. You can see the sort of flaps of skin there, covering over some wax behind it. So we're just going to use the microsuction here to get this out. Just come into contact with the skin. You'll see the whole lot. There we are. See it all peeling away as one continuous piece. There we go. So a nice big chunk of skin covering the entrance to the canal. You can see where it was attached to the right side there, but trapping quite a large section of wax behind it. So we're just going to remove the wax now. And we've got some dry skin here to the right side, so we'll just take that away. There we are. Lovely. And there's the eardrum looking nice and healthy, so quite a simple extraction, that one. You can see the same kind of problem here on this side. Basically, this patient had come in with just reduced hearing, a feeling of fullness. They have had wax removed in the past, so they knew the sensation. We've just got a large chunk of wax on this side, a little bit of skin around the outside edge. We can see just breaking away there. So we're trying to get hold of that central section. There we are, you can see that coming away quite nicely, a large chunk. There's quite a bit more still in here, so we're just going to take away, you can see that flap of skin there. Just start taking some of this away and get into that larger piece of wax at the base there of the canal. That's the front end. It's left a little bit in the entrance to the canal, so we'll grab that now as well. There we go. And we've got a couple of little dots of wax on the canal, so we'll just take some of these dots of wax away. Last little section there coming away as well. There we go. And there's the eardrum. Looking a little bit dull, so possibly a little bit of fluid behind there. So this is what we removed from both ears. You can see about 4.5 centimeters, just under 2 inches. So we come up to our last patient in the compilation now. This gentleman's quite a regular wax builder. He's been to see us once or twice in the past. Quite blocked out hard sections of wax on the outer part of the ear canals here. So just going in with a bit of microsuction. Now there's quite an angular chunk at the front end of this wax. Now you know from previous videos that it's easier if we've got a nice flatter piece to work on. This one's quite angular. It's also very dry, which means that it's not always the easiest to get a really good suction grip on. So what I'm doing first of all is just trying to loosen this off the canal wall. Sometimes we can get in just enough of a grip, and with a bit of a wiggle it'll start moving down the canal, which is what's happening here. But there's a little flap of dry skin at the top of it, which is just causing a few problems. So we're just going to try and get a grip on that, take that away if possible. There we go. So now we can see a little bit more of the top end of the wax, so we can get a better idea of whether this is going to wiggle its way out of the canal. You can see it's not quite, it's moving a little bit. It's moving very slowly down the canal, but not quite enough as we'd like. So we're going to use the crocodile forceps now just to get a grip on this and see if we can pinch it either side so that we can, there they are, so we can just get a grip, enough of a grip to pull it forwards. This type of wax tends to be hard on the outside but soft. There you go, you can see it's soft in the center, which means it's not the easiest to get the grip on. And what we're going to do if we carry on using the forceps, we're just going to break a whole big chunk of the front end off. So we're going to go in with the Jobson horn now. I need to bring this forwards but also angle it to the right hand side, because if you bring it straight out it's going to bump into the outer part of the ear and you're not going to be able to get the angle to get it out. So I'm just trying to bring it forwards, just working it down. If you see, I'm always going to the same kind of position in the ear canal, so not too deep, but bringing the wax forwards and then going back into the same position and bringing it forwards again, and it just helps to slowly work it out without digging too deeply in there. You can see quite a big chunk there. Let's take a look at the eardrum. There we are, there's the eardrum, all looking nice and healthy. Patient has exactly the same problem on the other side, but the wax is a little bit softer on this side. So it means that although there's an angular front end to this wax, when we get a grip on it with the suction will pull into the wax a little bit more, which means that we get that slightly better grip. So you can see it's moving a lot more when we get the suction onto it. So what I'm doing here is just wiggling, working it up and down, just there you go, trying to work it out the canal. You can see that as I'm bringing it out, I'm trying to push it to the left side. There you go, trying to move it out from against the canal wall on the left side, but it's a bit too long to get out. So what I'm going to do is go in with the Jobson horn, just get above it and push down and into it. There we are, and that's rolling out there now quite nicely. Get it all the way out. There he is. Nice, quite a large chunk there as well. And there we are, there's the eardrum all looking nice and healthy. So these are the two pieces we removed, so about 1 centimeter each. thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.